Hello, I'm Aimee Steinbrink, and we're going to be going through a sterile procedure today. We're going to be going through donning sterile gloves. Donning sterile gloves is very, very important in our field. We do not want to contaminate our patients or ourselves, hence the reason for putting on sterile gloves. So let's get started. First of all, I have these evaluation forms to hand out to you. So you can evaluate me after we're done. Okay. First of all, we're going to be getting materials that we need first. We're going to be getting a package of sterile gloves. They come anywhere from sizes 6 to 8.5. If you're more of a small-handed person, you're probably going to go for more of a 6 or 6.5. Larger, 8 or 8.5. I'm about a medium, so I'm going for 7.5. You might need to try a couple of on to see which size fits you the best. And that's okay. So what we're going to do, step 1, we're going to wash our hands with warm soap and water very, very well. Or we can also use an alcohol-based rub to get the microorganisms off of our hands. We want to have clean hands when we put on sterile gloves. Okay, step 2. We're going to take our sterile package and we're going to open the outer package away from us, and we're going to simply drop the inner package onto the table or wherever we're going to be putting them on. Okay. Step 3, we're going to carefully open up the sterile field. You want to make sure not to touch the inside of your sterile field. You don't want to contaminate it. If you do, that's okay. You just need to get another package and start over. Okay, we're going to open up our sterile field here. Okay. Step 4, we're going to take our left hand and we're going to grab the cuff of the right glove. It's going to be the opposite if you are, okay, I'm right-handed, so I'm going to grab the right glove with my left hand. The opposite, if you're left-handed, you're going to grab with your right hand. Okay? So I'm going to grab with my left hand. I'm going to hold it away from me, and I'm going to slip my hand into the glove. Okay? Just like that. Now I'm going to take my right hand, and I'm going to go underneath the cuff of the left glove. I'm going to hold it out in front of me, and I'm going to slip it onto my left hand. Okay. Now you can, what I like to do is I like to pull down the cuff right away. You can wait. Now you're going to take your left hand and you're going to pull down the other cuff over your other wrist. Okay. Now you have sterile gloves on. What you need to remember is not to touch anything that's not sterile. Hold your hands away from your body so that you don't risk contaminating them. And also you need to remember not to go below waist level, because that's also considered contamination of your gloves. Okay? So that concludes the presentation. Do you have any questions?
How do you take them off when they're not sterile anymore? Dirty gloves.
Very good question. How do you take off the gloves? As we know, we get a lot of things on our gloves when we're doing sterile procedures. Lots of stuff. So what we're going to do is we're going to remember the glove-to-glove, skin-to-skin technique. We're going to take our gloved hand, and we're going to go and grab the cuff, and we're going to slide it off of our hand, crumple the glove that you just took off inside your other gloved hand. Skin-to-skin, you're going to take your hand, and you're going to go underneath the glove, the cuff on your wrist, and you're going to pull outside around. Okay? And you're going to take off your gloves. And then you can just simply throw them in the garbage or wastebasket. And that's about it. So do you have any other questions you'd like to ask?
If it's considered a biohazard, does it need to be in a biohazard container?
Yes. If you do have any kind of blood on your gloves, you can throw them into a biohazard container, which also, and you're going to know it because it has a red garbage bag on your container. So if you get any blood or anything like that on your gloves, you're going to need to throw them in there. You can't just throw them into a normal waste basket. So, also a very good question. Any others? Okay. All right, that concludes our donning gloves presentation. Hope you enjoyed it and keep practicing.